Let's get some more analysis now, and I'm joined by Professor Pierre Tatevin, who is the head of the Infectious Diseases Department at Rennes University Hospital and also president for the French Society of Infectious Diseases. Thank you so much for joining us, Professor. How significant is this demographic, the 12-plus age group of children, when it comes to halting the spread of COVID-19?
Yeah, I think it will contribute. They are almost 5 million. And it's both good for them because it's beneficial for them too. It has been shown in the clinical trials that it has more benefit than harm. And it's also mostly beneficial for the rest of the population, that it will improve our overall coverage of the population.
Yeah, and it will reassure quite a lot of people, won't it? Because from the beginning of the pandemic, we've said that, children are unfortunately quite often the asymptomatic, silent carriers of the virus.
Yes, and it's true that during the first wave, they have not been very contributive to the pandemic because they probably transmitted very few cases. But with the UK variant for the second and the third wave, they probably contributed more. So it's important now that we include them in our strategy to avoid the next wave.
And how can we expect the sort of the uptake to be? I mean, are people likely to come forward with their children? Have they already been coming forward with their children saying, I would like my 12-year-old to be vaccinated?
Well, we really don't know that. What we know is that it has improved over time because people have seen more and more people getting the vaccine around them, and they saw that most of the people were happy to get the vaccine. So I think it will increase. It will be probably slow, as it was slow for the adults, and we don't know until which proportion we can go.
But obviously this is the only way to reach the goal, which was, after all, set by the Institut Pasteur, which is to get 80% of the population vaccinated. Were that to happen, would we achieve herd immunity?
Well, I think we can. It will be tricky because 80% is a lot. But even if we don't, if we stop at 75%, it will not mean that it was useless. We will have a wave, but it will be smaller than if we didn't reach the 75%, for example. So it's not like if it was, if we don't reach the 80%, we will lose. It will still be good to have protected as many people as we can.
Do you think there was ever any discussion about making this compulsory, or do you think it should be compulsory that people in that age group, children who are in schools, which are infectious environments, lots of bacteria, lots of germs around the place, should it be compulsory?
I don't think so. When you have to put it compulsory, it means that you fail in terms of communication. I will really prefer that we manage to explain to the people that it's good for them and it's good also for the people around them.
Okay, so what do you say to a parent who is worried or hesitant about getting their 12-year-old vaccinated? What would you say to reassure them? And is there one jab that might be more suitable than another for this age group? I don't know, is Pfizer or Moderna or any of these other brands of jab more suitable in your opinion?
I think they have to trust our health authority because they only approve the vaccine that has been evaluated with good clinical trials. And that's the case for the moment only for Pfizer, and that's why only Pfizer is approved in France. And I will also insist that it's beneficial even for their children. Of course, it's important for the whole population, for our coverage, but also what the clinical trials have shown is that you avoid the COVID-19, you may avoid the long COVID-19, you may avoid a lot of problems, you may avoid the necessity to postpone the travel during the summer or things like that. So it's beneficial for them too.
And what about the Delta variant? Obviously, that's the main cause of concern in a number of countries at the moment. Here in France, between 2 and 4% of new COVID cases are of this variety. Do you anticipate a rise in cases? And just how resistant does the Delta variant look to the various vaccinations?
So we don't have definitive figures about that, but the UK have shown evidence that if you receive the 2 shots with the Pfizer, you will be protected. So I hope we will have as many people as we can to receive the 2 shots before the India variant the Delta variant will increase. And in that way, we may control the expansion of this variant. But it's of sure concern, and it will probably increase within the next weeks.
Yeah, and there's a risk and a worry there, isn't there? Because I think, a lot of us are getting a little bit complacent. The vaccine rollout has vaccinated, let's say, 30 million plus French people. That's only 58% of French adults who've had 1 dose and only 27% who's had both. Now, if that's the case and we have a new variant circulating and it seems to have gathered pace at remarkable speed in other countries, mightn't it do the same here?
Yes, it might. You're right. And I think our best chance to avoid it is to increase the proportion of people who get the vaccine. And also, of course, to remain aware of barrier, the infection control measure that we all try to follow when we gather with other people.
Okay, so we'll keep up that social distancing and all go for our second doses of the vaccine, if indeed we've only had one for the time being. Thank you so much for sharing that with us. Always great to speak to you. Professor Pierre Tatevin, thank you.